Good morning. So I'm here with my mom to do the head to toe assessment. We're just gonna go through and do it the best we can. Usually things don't go in exact order, especially when you're doing it with the patient. We are going to assume that I have already gotten consent, which I have from her because we're here, and that I've washed my hands. I will try the best I can to verbalize everything I'm doing because usually, being a nurse, you multitask everything. So I am a nurse, so I'm going to try my best to verbalize everything, and we'll just get started. All right. So came in, got consent, washed my hands. Chatted with the patient, so I was checking, alert and oriented, asking about pain, anything of that, any areas that they're concerned about, things of that nature. A lot of the times you're doing many other things while you're basically doing an inspection of the skin and how they're breathing and all that, and like anything that stands out. So we'll just start, and like I said, I will just try to talk everything out. So we'll just go and we'll inspect the skin, palpate, start to the head, any tenderness, any pain, any areas of concern, come around. Usually I'll feel lymph nodes all the way around. I'm feeling, pulses on each side. I'm inspecting the ear while I'm looking at her eyebrows, her eyes, her nose, all that stuff. Her skin looks good. It's warm, it's dry, it's pink. Open your mouth, stick out your tongue, say I don't have a pen light, so I'll just assume that I have one. I would look at her mouth, see everything, look at her teeth, anything, areas concerning, fine. Puff out your cheeks, checking some cranial nerves while I'm in the general area, looking at her nose. Collapse one side and breathe out. Good, and the other side. Thank you. I move up to the eyes, pen light, don't have, but I would check her pupils. See if they're reacting normal. We'll assume for this case they are. Follow my finger. We're just checking for all the vision lines. Yes, great. So obviously those things are well, no areas of concern. So we'll go down and check, lymph nodes here, palpating her neck. No tenderness, no areas of concern. I'll come around the back. I'm going to feel her thyroid. Obviously no areas of concern. While I'm back here, I'll listen for lung sounds and assess the breathing. So first, take a nice deep breath. We're looking for equal expansion. Looking at, I would look at the skin, all over. She doesn't want to do that, so we're just assuming that I did that. Look for the spine, the curvature, all that areas that are like abnormal, one side not, inflating like the other is. We'll assume all that's fine. So now we're going to listen to her lung sound. So take some nice deep breaths for me. All right. While I obviously have my stethoscope on, I will listen to her each side. Make sure there's no abnormalities there. And I'll come around and listen to her heart sounds. I'll have her lean forward. Any murmur. All right, so now we'll do range of motion. Shrug. Beautiful. Pull me. Push. Okay, go out like this. Push. Okay, now fully extend. Do this. Do like this. Okay, don't knock anything over. Okay, squeeze my hands. Fingers. Alright, side to side, front and back. Obviously looking for any tenderness, moves they can't do, things of that nature. Obviously she's fine. We'll look at the lower extremities as well. We'll look at the skin, warm, dry, pink, fine. I'll feel the pulses while I'm down here as well. Check cap refill on her toes. Everything's fine. She's a fairly healthy individual that's young and drinks plenty of fluid. So usually sometimes you can't feel the pulses in the feet, but she's not a problem. So we'll check the reflexes. each leg. Usually you're dangling. She's in a chair, so we probably won't get the response we want, but dangling is ideal. And then we have the dull and the sharp and this little tool here, so we'll have her close her eyes and look, and we'll do that. Up my leg. Up sharp, sharp. All right, so I can put it down, that's all right. So obviously, like, I'll check her cap refill in her hands, do some skin turker, which is fine. You know, feel her pulses, which are fine. I don't think so. All right. We will move to laying down and continue our head to toe.